Imagine I stepped on a nail, and now I've got a nail sticking up through my shoe into my foot. So my foot hurts. So off I go to the doctor. And I let my doctor look at my foot and tell him it hurts, and he goes, "No kidding. You've got a nail sticking in your foot." So he said, "Here are your options for treatment. 1, we can anesthetize your foot. 2, we can put a great big thick pad in your shoe and distance that nail from your foot. 3, we can cut your foot off. 4, pull out the nail." So forgive my, what wasn't very funny, example, that the key is pulling out the nail. And until we pull out the nail, you're going to be anesthetizing your foot indefinitely. Did that make sense? So I know that you know this in a way, and maybe an easy way to think about this is, when did your first symptoms appear? And ask yourself, what was going on in your life at that time? I know it's what I like to do as a therapist. Okay, when you come in and whatever the presenting symptoms, so what was going on in your life? Well, it was about 2 weeks after my younger brother died. Duh. But if you listen to yourself or to others, you usually know, but you don't think in terms of, well, that's what really triggered this, got this started. Although I will tell you almost certainly that it has its roots in childhood and low self-esteem and, feelings of rejection and not feeling loved. But anyhow, I want to make sure I just make this general comment about what happens early on, and that there are factors that underlie a physical disease process. And if we're not going to deal with those, in my opinion, you're not going to change chronic disease from being chronic.